Welcome back, Focus Learners, to another explainer. Today, we're going to do something a little different. I want you to completely rethink almost everything you thought you knew about modern health. Seriously. We're looking at three groundbreaking sets of data from 2025 and 2026 that have literally flipped how the medical community views our collective well-being. We're talking fresh research from the American Heart Association, a massive plot twist from Harvard and Mass General Brigham, and some really eye-opening rural health data from the University of South Carolina. Let's get right into it. Okay, let's dive into this because the short answer here, it's a resounding yes. Look, we live in an era where medical technology is advancing at a blistering, almost unbelievable pace. I mean, we've got 4D organ mapping and incredible new therapeutics coming out daily. But right beneath that shiny surface of innovation, our shifting daily lifestyle habits are actually masking this massive, interconnected cascade of chronic risk. Literally millions of people are walking around right now completely unaware that their own physiological and geographic realities are working against them. So here is our roadmap for today. First, we'll look at the heart of the crisis. 2, we'll talk about redefining the obesity epidemic. 3, the rural diabetes divide. 4, the true cost of inequity. And finally, 5, charting a healthier future. All right, starting off with Section 1, the heart of the crisis. 933,782. That is the staggering number of annual deaths from cardiovascular disease in the United States alone. To put that massive number into perspective, that's basically the equivalent of a major city just disappearing every single year. We're talking one life lost roughly every 34 seconds. It is a constant, relentless impact. In fact, cardiovascular disease claims more lives in this country than all forms of cancer and chronic lower respiratory diseases combined. It is, without a doubt, our absolute greatest public health challenge. But, cardiovascular disease is just a big umbrella term. To actually understand the threat, we've got to look at the distinct trajectories here. First, coronary heart disease. This is the single largest killer, responsible for over 371,000 of those deaths. That means blockages are causing a heart attack every 40 seconds. Then we have stroke, which is a primary driver of long-term disability, with about 795,000 new or recurrent cases annually. And the vast majority of those are ischemic strokes caused by blocked arteries. Finally, we're seeing this rising tide of heart failure. Right now, 6.7 million Americans are living with a heart that simply cannot pump efficiently enough. So the big question is, what's driving this immense strain on the heart? Well, that brings us to Section 2, redefining the obesity epidemic. Now, what's really interesting about this slide is the very definition of obesity just completely changed. When a new framework, endorsed by the Lancet Diabetes and Endocrinology Commission, was applied to a massive NIH cohort, the U.S. obesity prevalence rate instantly bumped from about 40% to nearly 70%. You heard that right, 70%. Practically overnight, millions of people who thought they were totally in the clear were reclassified as being at high risk. So how exactly did this happen? Well, for decades, we've relied almost entirely on BMI, right? Which, let's be honest, is basically a simple math equation from the 1800s using just height and weight. Our standard bathroom scale has kind of been lying to us. This new criteria uses anthropometric measures. This looks at actual fat distribution, waist circumference, and the waist-to-hip ratio. The researchers found that millions of individuals with a quote-unquote normal BMI actually have what's called anthropometric-only obesity, meaning they have dangerous accumulations of visceral fat wrapped around their organs, placing them at a severe, previously hidden risk for diabetes and cardiovascular disease. The shockwaves this sent through the medical community were palpable. Dr. Lindsay Foreman, a Mass General endocrinologist and Harvard Medical School assistant professor, hit the nail on the head. She said, "We already thought we had an obesity epidemic, but this is astounding." This study analyzed over 300,000 Americans, and the new data revealed that this hidden risk is especially pronounced as we age. It affects nearly 80% of adults over 70. It completely reframes who actually needs preventative care. But as you'll see, hidden risks aren't just physiological, they are geographical too. Which leads us to Section 3, the rural diabetes divide. And this brilliantly illustrates what we're talking about. we are seeing severe, widening geographic fault lines in our healthcare system. Between 2021 and 2023, while new diabetes cases in small and large metropolitan areas either stabilized or even slightly declined, the incidence in non-metro or rural areas practically doubled. It jumped from 5.63% to 11.37% in just 2 short years. Guys, we are looking at a rapidly accelerating crisis just outside of our urban centers. And this geographic divide unfortunately builds into a fatal disparity. When we look at diabetes-related mortality for adults age 65 and older, the contrast is just stark. Large metro areas see about 113 deaths per 100,000. Small metro areas climb a bit to 126. But in rural, non-metro communities, that number surges to 144 deaths per 100,000. Basically, the further you live from a major city, the deadlier a diabetes diagnosis becomes. Take a look at this map. Notice those deep red clusters glowing across the southeastern United States? We're talking states like Mississippi, Alabama, and Arkansas. Those represent the absolute highest mortality rates in the country. And this isn't just happening by chance. It's driven by deep systemic issues. There is a severe lack of endocrinologists and specialists in rural counties, way greater distances to healthcare facilities, and long-standing economic disparities that just make managing a chronic disease incredibly difficult. Which brings us to the national burden. Let's zoom out a bit for Section 4, the true cost of inequity. The economic toll of all this is almost incomprehensible. Between 2019 and 2020, the total direct clinical costs and indirect costs, things like lost productivity, from cardiovascular disease reached an astounding $437.5 billion in the US. And because of those rising obesity and rural diabetes trends we just explored, brace yourselves. This financial burden is projected to nearly double within the next decade. We aren't just looking at a health crisis. We are staring down a massive financial avalanche. But we really must remember that these costs and these diseases do not strike equally. Social determinants of health are acting as the primary drivers of mortality here. For instance, Black Americans face the highest prevalence of hypertension globally at 57.1%. Our rural areas consistently lack access to nutritious food and safe, built environments for physical activity. Furthermore, the COVID-19 pandemic severely disrupted chronic care management, meaning millions of people missed out on those crucial early interventions. The hard truth is, where you live, your race, and your access to resources dictate your health outcomes a lot more than we'd like to admit. So how do we take this massive structural information and turn it into actionable preventative knowledge? Let's wrap things up with Section 5, Charting a Healthier Future. The American Heart Association gives us a really powerful framework called Life's Essential 8. The data tells us that at least 40% of cardiovascular cases are potentially avoidable through modifiable habits. That's huge. This means focusing on what we can actually control. For example, a recent CDC study reveals 36.3% of adults are sleep deprived, and poor sleep is now firmly recognized as a major cardiovascular risk factor. We also need to get moving. Currently, only 24.5% of adults meet physical activity guidelines. By just improving our sleep, increasing our daily activity, and regularly managing blood pressure, we drastically alter our personal risk profiles. You really got to ask yourself, are you hitting those marks? On a broader systemic level, we need structural solutions to bridge that rural-urban divide we mapped out earlier. First up, expanding telehealth is absolutely crucial to bypass geographic barriers and connect rural patients with endocrinologists. Second, we really need to deploy community health workers directly into underserved areas to provide on-the-ground support for chronic disease management. And finally, expanding community CPR training is vital for addressing the hundreds of thousands of out-of-hospital cardiac emergencies that happen every single year. So the crucial point is, this entire shift in understanding is perfectly captured by Dr. Foreman. Body composition matters. It's not just pounds on a scale. Our metrics for evaluating our own health just have to evolve. We can no longer just look in the mirror or step on a standard bathroom scale and assume our cardiovascular metabolic systems are perfectly fine. We have to look deeper at fat distribution, stay highly vigilant about our blood sugar regardless of our weight, and really advocate for comprehensive screenings with our doctors. Which leaves us with this final, incredibly important question. How will you navigate your health in this new landscape? The data from 2026 is crystal clear. The risks are often hidden, whether they're hiding behind a quote-unquote normal BMI or hidden within the very zip code you live in. But hey, knowledge is agency. By understanding these new definitions of obesity, the stark rural disparities, and the preventative power of our daily habits, you have the tools to take control of your metabolic and cardiovascular future. Thank you so much for joining me for this Explainer Focus Learners. Stay curious, stay proactive, and I will see you next time.